Hello, good morning. I'm Kamay. I'm the nurse that's going to be on for this morning, and I'm here to do the head to toe assessment for your newborn baby girl. Do I have your permission to do that? Yes. Okay, thank you for giving me your permission. Can I check your armband? Yes. Can I check the baby's name tag as well? Okay, thank you. Okay, so the head to toe assessment, we do observation, we do vital sign, we do measurement, and we do physical assessment. So I start by looking at the baby, and I'm not seeing any lumps, bumps, bruises, or lesions, or any discolorations, and the baby appears to be in no distress. Okay, so now I'm gonna do the respiration, and I'm counting the breaths, and I'm getting 34. That's good. So now I'm gonna move on, and I'm gonna do the apical pulse. And I'm sorry, I'm on vacation. I forgot my stethoscope, so that I'm using a make-believe stethoscope. So the apical pulse is formed at the fourth intercostal space, the left mediastinal area. So I'm listening to the pulse, and I'm getting 148, which is good. And now I'm going to move on to the temperature, and I'm putting the thermometer here, and I'm getting 36.6, which is good. So now I'm going to move on, and I'm going to do the head circumference. Okay, hi baby, coochie coochie coochie. Okay, so the head circumference is 34, which is good. Pardon me? If she has microcephaly? No, there's no microcephaly. If it was microcephaly was present, it would be less than, the head circumference would be less than 32. Oh, you had Zika when it was going around. Okay, so according to the article by Pereira, if baby's gonna get microcephaly from Zika, it would be when you're pregnant, especially in the early part of the pregnancy. So I'm not seeing any seizure activities, and the head circumference is in the normal range. Okay, did that answer your question? Okay, thank you. Yeah, there's no sign of microcephaly. Okay, so I'm going to do the chest. There's no clothes here because this can't come off. So the chest circumference is 36, which is good. And then I'm going to do the heel to the crown to heel measurement. And I'm getting 50, and that's good as well. So now I'm going to move on to the physical assessment. Hi, darling. So I'm going to start by checking the anterior fontanelle, the posterior fontanelle. They're both normal. Check the ears, and the ears are fine. They're in alignment. And check the eyes. The eyes are fine. They're lined up with the outer contours of the ears. And I'm checking the nose and the mouth. Oh, she's sucking on my finger, so that's good. The sucking reflex is there. That's good. So I'm checking the neck to see if there's any creasing or any abnormalities, and there's none. So next, I'm checking her upper extremities, her hands, and they're the same length and the same size. And she's holding on to my finger, so that's good. The grasping reflex is present. So next, I'm going to check the lungs. The chest is going up on both sides. It goes up the same, and it goes down the same, so that's good. So I'm just going to check the lung sounds. I already counted the respiration. Lungs sound good, lungs sound good, lungs sound good, lungs sound good. Okay, that's good. And I already did the apical pulse. So I'll just check the nipples. The nipples are fine. There's no extra nipple. And I'm going to check the abdomen. Okay, I checked palpate the liver. It's fine. So now I'm checking the umbilical cord. I see 2 arteries and 1 vein, which is good. No sign of infection. So now I'll check the abdomen. I've parted it in 4 quadrants, and I'll check each quadrant to ensure that their bowel sound is present. Okay. Listen, 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 listen. Bowel sounds are present, which is good. So now I'm going to move on to checking the lower extremities. The legs are the same length and the same size. There's no extra toe, which is good. So I check the genitalia. There's no swelling. There's no abnormal discharge. And I check the anus. The anus is patent, which is good. And I turn the baby over, and I check the spinal cord for curvature. There's no curvature there, so that's good. And I'm going to check the baby's reflex. Startle reflex. Oh, wow, that's good. The startle reflex is present, so that's good. Do you have any other question that you like for me to answer? No? Yeah, so there's no sign of microcephaly, and she's doing fine. From the head to toe assessment, I'm not finding any abnormalities with her. Okay, thank you.